Hey, I'm Dr. Eti Ben Shabbat, and today I'm going to speak with you about the radiology reports of repeated scans. Because a little while ago, someone contacted me and she said to me, Eti, the radiology reports of the repeated scans are not like the ordinary reports. They are so different and they do not have the information that I need. What do I do about it? See, the problem is that when you look at radiology reports of repeated scans, they don't have the information that you necessarily are looking for. And so you need to go hunting for that information. And when you hunt for that information, you open lots of scans and lots of radiology reports, and you end up spending a lot of time and in the process probably getting frustrated as well. So in this video, I'll talk about what the repeated scans are. I'll talk about why the report looks different to the initial radiology report, and I'll talk about what sort of information is there and what sort of information is missing. I'm going to explain how you can find the information that is missing, and I'm going to give you a 4-step system to look at the brain images and identify the information that you're going to need and obtain it. So I'm going to use an example to make it all clearer for you, and let's make a start. Say you are a rehabilitation clinician and say you are seeing someone. They were admitted. This is their third admission. They had 2 admissions before, admission A and admission B. In each one of their admissions, they had scans taken. And they also had quite a few scans taken in their current admission. For example, they would have had a scan taken when they were admitted, maybe another one on day 1, another one on day 3, maybe an MRI on day 10, a CT scan, and another MRI on day 50. So the question is, why are there so many scans there, and which scan do you look at? What's important to understand with scans is that every scan is taken to answer a particular clinical question. So on admission, the question is usually, what is the pathology? What is the diagnosis? What is actually going on in this brain? As opposed to day 1, where the question might be something like, is the treatment that we're giving this person helping them? Is it working? Is it not working? On day 3, there might be a question like, this person is not progressing quite like we're expecting. What's going on there? And then day 10, they might have change in their symptoms, and therefore the question was, is there a change in the pathology or in that lesion? Therefore, they are taken to another scan. And day 21 might be, we want to change the treatment. Let's see whether it's safe to do so. Is the brain stable? Can we go ahead with that change? Day 50 might be, let's have a look at the evolution of this lesion and see where this person is at in terms of recovery. So you can see that every scan has a question. And if every scan has a question and the job of the radiologist is to answer it, the radiology report will be written to answer that clinical question. And this is the reason that the information in the radiology report of subsequent scan is very different to the radiology report that you'll see in an initial scan. And often it will be in the context of comparing to a previous scan. In comparison to the previous scan, we can see that there was a change or there wasn't a change. So when you choose your scan to look at, usually I suggest to people, look at the scan that is closest to the time that you're seeing the client, because that will represent the best way how the brain is closest to the time that you're seeing your client. And when you look at the radiology report of that particular scan, you need to evaluate the information that is in this report, and does it have the information that you need? And the way to do that is to follow 4 steps. Step number 1 is evaluate. You evaluate what sort of information is there and what sort of information is not there. Step number 2 is analyze. And that's about, okay, what sort of additional information do I need as the treating clinician or rehabilitation clinician? What is the information that I need to be able to treat this person better? Then there is obtain. How do I get that information that I need? And step number 4 is about thinking. Thinking about the whole process, the whole timeline between when the person was admitted and when you're seeing them, and asking yourself, is there any additional information I need? So let's use an example to put this framework into practice. This is a case study I gave a workshop on, and it's a case study that was actually uploaded onto Radiopedia. So in Radiopedia, you can find the actual images of this case. And to find it, you just take the reference of this case. So in this case, it's number 93012, and you type it in the search function of the Radiopedia website. So in this case, the person was admitted with stroke symptoms. On admission, they had some CT scans done with CT perfusion, and it was decided that this person needed to have clot retrieval. They had one clot retrieval, had another set of scans. They decided to go into a second procedure for clot retrieval because they figured out there's still some clot there that needs to be extracted, removed. And so a second clot retrieval was undertaken. Then on day 2, the person was not progressing exactly like the clinicians were expecting, and so the person had another scan. And then on day 3, they progressed to deteriorate, and day 3 they actually had craniectomy, which is a removal of part of the skull to enable the brain to swell without being compressed. And on day 3, there was another CT scan, and you can see the craniectomy there already. Then this person was transferred to rehab. There was another scan taken on day 26, and there was some new swelling developing over the brain. And on day 30, there was another scan to find out why that swelling was there. On day 84, there was another scan, and that's because there were some new symptoms, so they wanted to find out whether there's a change in that lesion. There were a couple of other scans that were taken on day 43 and day 58, but the point I wanted to make there is that there's a lot of scans in this film bag, and it's unrealistic to have a look at all of them and read all the reports before you see your client. So say I'm seeing this client in rehab. So they moved into rehab, say it's day 24, for example, and I need to choose which scan to look at. I will look at the scan from day 3 because it's closest to the time that I'm seeing them, because I haven't had the scan from day 26 yet. See, if it was day 28 that I would see them, then I'll have a look at the scan from day 26. But if I'm seeing them on day 24, I'll look at the scan, which is day 3. So the radiology report talks about the expected evolution of the non-large left MCA territory infarct. So talking about left MCA area. There is a lot of information about the edema, the inflammation, the swelling and what it causes. There's also information about herniation, comparing the amount of herniation to what happened before. They're talking about the decompressive craniectomy, so the surgery that this person had. They talk about hemorrhages. They're also talking about left basal ganglia hyperdensity, which is also suggestive of a bleed. So when you go on to step number 1, which is evaluate, we can see that in the radiology report, there's a lot of information about the pathological processes that are going on in terms of infarct, hematomas, and herniation. But there's a little bit of a limited amount of information with regards to the location of the lesion. So we know it's the left MCA, and we know there's a bit of a bleed around the basal ganglia, but we don't know exactly which anatomical structures are affected, and we don't know which sort of functions are affected either. So the second step is to analyze what additional information do you need. Now, when you think about the radiology report, the information in the radiology report falls into 3 categories. Information about lesion location, information about the pathology, and information about differential diagnosis. So you need to sort out whether the information that you need is about lesion location, or is it about pathology, or is it about, could it be a different kind of pathology going on there? So then the third step is about obtaining the information that you need. And as you can imagine, depending on what information you need, your way of obtaining it will be different. Let's just start by saying that no matter which category of information you need, the first scan and the first radiology report is a great place to start, because that was the place where the radiologist had to decide which diagnosis it is and why they think it is that diagnosis. And so you get more information about the 3 categories there. But even in the first radiology report, you don't always get a lot of information about all the categories. So if you need more information about lesion location, find someone that had brain imaging training. Now, it might be a rehabilitation clinician who did my course, or it might be a radiologist. It's someone who can answer your questions about the exact location of the lesion. If your question is about pathology, then you need to talk with the neurologist or the rehabilitation physician or the radiologist. But if your question is about differential diagnosis, probably the best person to talk with is the radiologist. So to obtain the information that is missing, you go to the clinician, the professional that will have the best ability to answer that question. And then the final stage is think. And it's about thinking about the information that you might need. So if the person has lots and lots of scans in their film bag, the question is, how did they present initially and how do they present now? And the second question is, what happened in between? What sort of milestones in their progression, or what sort of regressions there were in their progress, and due to what reason? And that's often important to identify those time points. Again, how you approach the brain scans and the radiology reports will be determined by your level of competency. So if you're a novice with brain imaging, what you're likely to do is go to the clinical notes and identify those milestones, those time points in which there were changes in the clinical presentation or what was going on with the pathology, and therefore you need to know about them and you will view the radiology reports of those times. But if you're a trained clinician and you know how to look at brain images, then what you're going to do is identify those milestones in the film bag and then look at the brain images of those particular milestones. So you have a clear idea about what happened initially, where the person is at right now, and what sort of hurdles they had along the way. In line with that way of thinking, I've uploaded into that case in Radiopedia the radiology reports and the scans of those milestones, of those times that there were significant changes in this person's progress. So admission is there, the CT scan after the first clot retrieval is there, the CT scan after the second clot retrieval is there, the CT scan from day 3 after the craniectomy is also there, and the CT scan from day 30 where there was inflammation, swelling around the lesion, that's also there. And the final scan on day 84 when it wasn't clear whether the new symptoms correlate to some changes in the brain, and therefore another scan was taken. So now let's summarize everything that we covered in this video. We talked about the reports of the repeated scans, and we talked about how they're different from the initial scans. And the reason for that difference, because the clinical question that was the basis of the scan is different from scan to scan. Then we talked about not wasting time hunting for information in the film bag, but using more of a targeted approach to the information you're seeking. I talked about the system, the 4-step system for obtaining that information, where you initially evaluate what you have and don't have in the radiology report. Then you analyze what is the information that you need. You go ahead to step 3, which is obtaining the information that is missing. And then stage number 4 is thinking, where you put it all in context and think, how does it all fit in terms of milestones, clinical milestones that this person went through. So I hope you're going to use that system now, and I hope you're going to waste less time on hunting in film bags. I would love to know if you found it useful. Please like and share, and I'll see you in the next video.